Question 10 asks, how do you monitor the health of workers who are or may be exposed to hazardous conditions, products or substances? This question is worth 15 points and is a question that has really driven changes in the way employers respond to concerns about the health of their workers when or if they are exposed to hazardous conditions, substances or materials. In the past, this was a question many companies didn't think applied to them, or they simply had never considered the harm caused to their workers due to the exposure to noise, dust, fumes, asbestos, etc. However, this situation has changed dramatically over the past 5 to 6 years. The awareness and necessity of health monitoring is gradually changing, with more employers showing greater concern for the health and well-being of their workers, and is one of the good news stories about Sitewise and the influence the assessment process has had on bringing awareness to this issue. The real upside is that the workers feel considered and more valued because they are being looked after in these situations. In most cases, the necessity to provide health monitoring is obvious. However, if you're uncertain, an effective way to find out is to get a qualified occupational health and safety professional to come into your workplace and carry out an assessment of your working environment. Getting a baseline test for workers creates a starting point so you can compare and measure results of monitoring further down the track and gauge the effectiveness of PPE being used. The most common types of health monitoring include hearing tests because of exposure to high levels of noise and lung functioning tests due to the exposure to fumes, dust, chemicals or asbestos. Other types of testing include eye tests, mole mapping and blood tests for pathogens. Best practice is to carry out monitoring of your workers if there's any chance of exposure to hazardous conditions such as working near to noisy machinery, fumes, chemicals or working with asbestos. To get full points, evidence of regular health checks and baseline or pre-employment testing is required. If you're a smaller company and or have not employed any new workers during the previous year, your first annual assessment can be accepted as pre-employment evidence. If this is the case, please upload last year's evidence along with new evidence of health monitoring that has taken place. The level of health monitoring you are doing should match the things you have listed in your risk register. For instance, if your register contains concrete cutting, this indicates that there will be exposure to high noise levels, so hearing monitoring should be in place. If you're a sole operator, this question can be marked as not applicable. However, if you are exposed to hazardous conditions, best practice would suggest you should have yourself tested on a regular basis.